Dr Everingham, you were a family doctor and a government medical officer before you were a federal MP and Gough Whitlam's health minister. When you were a practicing doctor, you believed in water fluoridation, but by the time you were Australian health minister, you were very concerned about the practice. Can you tell me how that happened?
Well, when I graduated in the late 40s, most doctors and dentists in the Western world, or certainly those that are now using fluoridation, thought it was a great idea, and I was quite enthusiastic about it and wrote to the local paper saying that we should have fluoridation. I was immediately challenged then, and when I was given some literature on the other side, I changed my mind, particularly a study that was criticising the faults and weaknesses of fluoridation trials written by the head of the dentistry school in Melbourne, Dr Sir Arthur Ames, who wrote jointly with an epidemiologist called Dr Sutton. And they found all these errors, and this was one of the things that changed my mind. I've been studying the subject ever since.
Could you tell me about your experience when you were the Australian Health Minister?
Yes, well, I obviously got a fair bit of literature from people interested in fluoridation, and like most of my replies to correspondence, there were answers drafted by my department, and they invariably said fluoridation was safe and effective, which I would never sign. I always sent it back for redrafting, and I had to do this quite a few times before they got the message, saying that we have unconfirmed reports of harm from lack of, well, damage to the thyroid gland and bones and so on. There were various reports that had never been individually challenged and confirmed or refuted.
When Premier Bligh announced forced fluoridation in Queensland, you wrote to her asking her not to proceed. Could you tell me what happened?
Well, all my correspondence with state and federal officials, state and interstate, stressed this official line that it's safe and effective. And I really got no further because there was no specific reply to specific damage claims that had been investigated and not properly confirmed or refuted.
I believe the NHMRC has never done any health and safety studies on fluoridation, and they've never done any monitoring of intake or bone fluoride studies.
Well, they have recommended certain investigations. Whether they ever started, I don't know, but if they started, they never went very far because they ran out of resources or funds. They had recommended that studies be made to detect the total fluoride intake, not just from water, but from the various foods which have varying degrees of fluoride content. And those studies were never proceeded with. They recommended it about 10 years ago, I think. And they also added that there should not be fluoridation before such studies were completed, which of course has been ignored by those countries that still promote fluoridation. Holland and most of Scandinavia and others, in fact most countries in the world, have not implemented or even have rejected fluoridation.
If fluoridation was safe and it really did reduce tooth decay to any real extent, would you then support water fluoridation?
Well, I don't think so, because I've got evidence, the evidence that I've read suggests that it can't happen. It can't. The only benefit for fluoride seems to be in case of putting local applications of fluoride to the surfaces of teeth. And they've never proved how that works. Possibly it works by killing bacteria that produce dental decay.
A lot of people are opposed to water fluoridation because they see it as forced medical treatment. Would you agree with that?
Yes, I agree that you should always err on the side of caution until you're certain before you start forcing things. And in fact, there's no need to force fluoridation if you've got a means of giving people the choice, which we don't have.
Thanks, Dr Everingham. I think that says it all. Thank you.
Good.